In today's health alert, the CDC has updated its COVID-19 vaccine recommendations, calling it individual-based decision-making, and it applies to anyone ages 6 months and older.
Yeah, our chief health editor, Dr. Partha Nandi, joins us now. And Dr. Nandi, what does this mean for Michiganders, and is a prescription required?
Yeah, the CDC's change means that we're moving away from one-size-fits-all approach. It's really about what's right for you based on a conversation with a qualified healthcare provider, doctors, nurses, and pharmacists, not with your influencer. The decision to get vaccinated is personal and can depend on health factors beyond age, things like underlying medical conditions. And that's because conditions like chronic heart or lung disease, diabetes, weakened immune systems, or obesity can really increasing your risk regardless of age. You can check the CDC's official list online for full details. As for a prescription, you do not need it here in Michigan. You can still get vaccinated at major pharmacies like CVS, Walgreens, Meijer, and at local health departments in Detroit, Macomb, and Wayne counties. Now, primary care doctors' offices don't carry the vaccine, so the easiest approach is to call your doctor or local pharmacy to see where it's available.
Now, something else being recommended, the chickenpox shot for toddlers. Why the change from the CDC?
Yeah, what they wanted to do was they recommended that children under age 4 get a separate varicella or chickenpox shot. Before, parents could choose, Simon, to have it administered with the measles, mumps, and rubella in the MMRV shot. While it's convenient, it carried a slightly higher risk of fever-related febrile seizures. And when given as a first dose to toddlers between 12 and 23 months. Now, febrile seizures are rare, but they can be scary for parents, but usually pass without harm. Giving the chickenpox vaccine on its own lowers the risk without reducing protection. Now, personally, I have 4 kids and they're all up to date on vaccines. To me, it's super important that they're protected against disease. I want to point out that the American Academy of Pediatrics strongly recommends COVID shots for children aged 6 months to 2 years. For older kids, still advised, but parents can make their choices. With the virus season coming, I believe it's super important to have COVID protection for kids.
Glad to hear your perspective as we keep up with these guidelines.
Absolutely, sir.
Thanks a lot, Doc.
Of course.
And if you have a health question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or on X.